Assalamualaikum warahmatullahi wabarakatuh po. My name is Okara Utaratingan from SPMC Group 10. So today I'm going to present my simple case study entitled Schizophrenia Disorder. So let's start. For my objective is to understand the psychiatric conditions of the patients and its impact on behavior and functioning. And next is to apply Erik Erikson's psychosocial theory and analyzing the patient's development. And next is to identify signs and symptoms and treatment of schizophrenia. And next is to create a comprehensive nursing and medical management plan. And the last one is to provide recommendations for rehabilitations and recovery. So, for the definitions of the disorder, schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. Patients often lose touch with reality, experience hallucinations, delusions, and disorganized thinking. It requires lifelong treatment and supports. For the psychiatric history, first is yung identifying data. For the identifying data is napapaloob dito yung patient profile. First is the name Richard Del Campo, address Puro 4, Suay Baguio District, Tagum, Davao del Norte. Status single, age 45 years old, sex, male, religion, Catholic, date of birth, February 7, 1980. Admission date, October 11, 2022, 4:45 p.m. And na-admit si Richard Del Campo with diagnosis of schizophrenia. For the chief complaint, violent behavior, naghubo na siya doc ng mananakit na. And for the history of present illness, for the first onset in 2017, symptoms of schizophrenia, hallucination, disorganized behavior. And for the second onset in June 2022 after the death of his maternal figure. For the precipitating factors, June 2022 is mas na-trigger yung sakit ni Mr. Richard Del Campo dahil namatay yung kanyang mother. And then, mas naglala siya kasi mas naglala yung sakit ni patient Richard dahil sa family dahil sa stress sa family. And for the predisposing factors is family history of illness, hypertension in mother, and diabetes mellitus and father, and possible genetic vulnerability. For the history of alcohol and illicit drug use, which lower his resilience. And according sa chart is si Mr. Richard Del Campo is nag-positive siya sa illicit drug. And male gender, slightly higher risk for early onset schizophrenia. For the premorbid personality, not under to guardian or they are younger than the patient. So, proceed tayo sa past illness. For the past illness is psychiatric na diagnosed with schizophrenia disorder in 2017 and re-diagnosed in 2022. Episodes of hallucinations, delusions, and disorganized speech and behaviors. And also poor impulse control, aggressions, poor hygiene, and poor concentrations. For the medical, no history of chronic illness like hypertension or diabetes mellitus or cancer. For the alcohol and substance abuse is history of illicit drug use and tobacco use disorder. And proceed tayo sa psychodynamic by Erik Erikson. For the infancy, 0 to 1 year old, trust versus mistrust is possible, and consistent care or emotional neglect may have contributed to difficulty trusting others. For the early childhood, 1 year old to 3 years old, autonomy versus shame doubt, limited independence may have caused low confidence and dependence on family. For the preschool, 3 years old to 6 years old, initiative versus guilt, early initiative may have been discouraged, leading to passive behavior and limited assertiveness. For the school age, 6 years old to 12 years old, industry versus inferiority, possible struggles in academic or peer relationship contributed to low esteem and limited coping skills. For the adolescents, 12 years old to 18 years old, identity versus rule confusions, Richard Del Campo may have struggled here because leading to poor self-identity and vulnerability to mental illness. For the young adulthood, 18 years old to 40 years old, intimacy versus isolations, being single and socially isolated suggests possible failure to achieve intimacy, leading to loneliness. Middle adulthood, 40 years old to 65 years old, generativity versus stagnations, shows signs of stagnations, unable to fulfill productive roles dependent on family, experiencing regressions due to schizophrenia. So, proceed tayo sa sign and symptoms. For the positive symptoms, meron tayong hallucinations, delusions, and disorganized speech. And for the negative symptoms is ito yung makikita dito yung blended or flat affect, poor hygiene, social withdrawal, and lack of motivations. Proceed tayo sa medical management. For the medical management is meron tayong antipsychotic. For the antipsychotic is napapaloob dito yung flupentixol, decanoated, flupentixol, decanute, 20 milligrams, flupinacin, and clozapine. And for the adjunct meds is meron tayong atorvastatin for cholesterol. And meron din tayong supportive therapy. For the supportive therapy is kailangan ng psychotherapy, occupational therapy, and structures activity. And the last one is yung substance use management. Kailangan is tobacco cessations, avoidance of alcohol or illicit drugs. Proceed tayo sa nursing management. For the nursing management is, first is, we need to ensure patient safety we need to ensure patient safety to remove harmful objects and to monitor aggressive behavior and to provide a secure environment, because schizophrenia can cause hallucinations, delusions, and aggressive behaviors. And second is use that we need to use the therapeutic communications, because speak clearly and calmly, and calmly, it helps to build trust and to reduce anxiety and also to promote cooperations. And next is assess with the self-care activities to encourage the patient for hygiene, grooming, dressing, and poor nutrition, because schizophrenia may cause neglect of personal care. And then, for the next is new medical management. For the medical management is administer antipsychotic as prescribed, and we need to monitor the effect and side effect of the medications. And then, educate patients and family. And then yun nga, kailangan natin i-educate yung pasyente or yung family according sa kailangan natin i-educate yung family or yung patient tungkol doon sa medication na iti-take nila. And then, pang-lima is psychoeducations for patient and family. We need to educate the patient or the family about schizophrenia or treatment, relapse preventions, and coping strategies, because it increases understanding, reduces stigma, and encourage family support and participation in care. And next is encourage participations and activity and socializations. Occupational therapy, recreational activities, and group engagement. It promotes social skills and to reduce isolations and also to improve self-worth. And then next is monitor and manage substance use to support tobacco cessation and counsel against alcohol and illicit drugs. And then next is monitor sleep and nutrition, encourage adequate rest and balanced meals, because sleep disturbance and poor nutrition can worsen cognitive and emotional function and schizophrenia. And next is provide emotional support and reassurance. Dito is we need to be patient, non-judgmental, and empathetic, because it helps reduce anxiety, agitations, and feelings of isolations, and also to improving the therapeutic relationship. And then, proceed tayo sa recommendations. For the recommendations is first is continue long-term antipsychotic treatment to ensure stabilizations of psychotic symptoms and to prevent relapse and manage aggressive tendency. And next is enroll in community mental health program. It provides ongoing psychosocial support, rehabilitation, and structural activity to improve daily functioning and social skills. And for next is family support and counseling. We need to educate the family about the schizophrenia to reduce stigma and enhance caregiving capacity with support recovery. And then, next is participations and psychosocial activity, improve social interactions, reduce isolations, and promote self-esteem and purposeful engagement. And next is addresses substance use through rehabilitations and counseling to prevent worsening of symptoms, avoid medication interactions, and promote overall physical and mental health. And then next is regular follow-up with the psychiatrist, allows monitoring of treatment response, adjustment of medications, and early detections of relapse or complications. And then next is psychoeducation for patient. We need to psychoeducation for patient, because it helps the patient understand their illness, recognize early warning signs of relapse, and adhere to treatment plans. And then next is encourage healthy lifestyle practice to balance diet, proper sleep, and exercise. And then next is structured daily routines to provide stability, reduce confusions, and improve coping with schizophrenia symptoms. And the last one is reinforce coping strategies and stress management. It helps the patient manage anxiety, agitations, or trigger that may worsen psychotic symptoms. And that's all. Thank you po.